and it's been a pleasure to attend this very important webinar. So in terms of what you have said, that it's absolutely crucial that we compare notes. So from that aspect, I'm very curious to hear from some of the other participants, because I haven't been to any other platform where we could share some of our experiences. So I will start with a short slide presentation. If I can share my screen really quickly to kind of give you a glimpse of what we are kind of going through right now. Can you see my screen?
Yeah.
Okay, great. So let's see. All right. So COVID-19 situation in Bangladesh. If you see the curve that suddenly has a spike uh, after April 5th, is I believe more to do with the increase of the testing facilities that was very centralized in the very beginning, when we first confirmed cases were diagnosed in March 8th. And at that time, I think the testing was very centralized by the government, and we on average we had about 40 to 50 testing per day. After a lot of sort of pressure and criticism, I think there has been a significant bump up in the expansion of testing capacity since the first week of April, and now we are doing about 3,000 per day, and on average last few days has seen a lot of spike. We have seen about on average 3 to 400 confirmed cases out of 3,000 being tested. So total number of death has been about 120, and fatality rate is about 3.2%. The spread right now is more or less throughout the country, even though there has been sort of attempts to identify hotspots. So the strategy for the government has been that the country has been in lockdown mode since May 26th. Having said that, there has been also specific area-wise lockdown to stop people from entering and exiting places which are particularly very high number of confirmed cases that has come in. So one alarming sort of statistics is that Bangladesh reached 2,000 cases faster than the worst hit countries. Number was doubled within 4 days, from 1,000 to 2,000. And as I was saying, that this is going up, and this may be partly to do with the increased number of testing, but it's very difficult to know because the early days the testing was very centralized. So we are not, and still the number of testing is very low compared to rest of the world. So it's very difficult to know where we are standing in terms of in the infection curve. Um, and if I talk about sort of where things are in terms of age-wise infection rate, I mean, unlike other parts of the world, I mean, Bangladesh is relatively a very young country. We have a huge number of about 48% who's relatively 24 or younger. So most affected group has also been from 21 to 40 as well, which is quite a significant number, about 49% altogether. Um, I want to kind of give a sense of also the public healthcare infrastructure that we have now, which is not in the best shape. So Bangladesh is in particularly in a quite a vulnerable position should their outbreak increase in at a faster speed going forward. We have roughly about 8 hospital beds for every 10,000 people, 5.26 doctors per 10,000 people. The ICU number of beds total in the country is about 1,257. And the number of ventilators that we have currently is one per about 300,000 plus people. So you can imagine that we are nowhere even in the current capacity of where critical care patients are often turned away just because of lack of capacity in public hospitals. So we are very much vulnerable to another spike in the sort of healthcare system because of coronavirus. So I want to now move a little bit from public health to the economic impact that is very much has taken a sort of a forefront in Bangladesh, which is um, again, I think social distancing has been put in place for the since March 26th, as I was mentioning, but it has been difficult to enforce in a lot of places. I mean, religious congregation wasn't stopped until about 2 weeks ago, but also we are seeing a lot of congregation happening in the markets, in various areas, and in a sense, it is also sort of um, being difficult to also get people out of the social stigma that has been attached by this disease. And so a lot of people, we are seeing a trend around people are being afraid to report because of fear of being locked down, or basically being stigmatized. So that is a common phenomenon. But going back to the economic point that I was trying to make, as you mentioned, Mukulika, in your opening, that Bangladesh and most countries in South Asia are very much dependent on the informal economy. So most of the about 85% of the employment comes from informal economy, and the country has become rapidly urbanized in recent days. So recent BRAC rapid assessment has shown that our sort of this group has been badly affected by this shutdown. The informal economy, the jobs that come from there, the urban poor, the low income population has been really, really badly affected. And so they're sort of the consumption has gone down in terms of food intake. They are sort of 16 in urban and rural, in average, sort of respectively, about 69% and 89% respondents in a BRAC survey recently reported that their income has gone down to the point, on average, about 75%. And that is a huge blow. And people have already started skipping meals that we have seen, and the unemployment has resulted also in a massive loss of earnings, and obviously they don't have a lot of sort of savings, and as a result they're struggling, and they're dependent on government social and economic transfer to come to them now. So this another survey, as I was saying, that has shown that about 70% urban areas and 55% rural areas that are now economically inactive. And suddenly, in the just only a matter of few weeks, we have had a huge rise in extreme poverty. So as I was mentioning, this has been a 75% drop, but there are also a number of new poor who have actually joined the group of poor right now, who are not part of any list, government list. So even though government has announced about 40,000 metric tons of food, of rice going to be given at a very discounted price, if you're not part of any list, you're not going to be able to get it. So that has been a big challenge for the new poor who has joined this group because of the last few weeks of economic shutdown. So economic GDP growth has been forecasted to be about 2% this year. That's a mighty fall from 8.515%. And our one of BRAC's we have a SME bank which has done its own survey, which has shown that about 67% of small businesses are now out of operation. They are badly hurt. 81% of manufacturing and 72% of trading businesses are currently closed as well. So this group will also need a huge support going forward when the economy jump starts. So in a sense, our opinion is that there has to be a very close collaboration, like everywhere else, between the public health sector and the sort of macroeconomist, in the sense that we don't make this crisis a humanitarian crisis, and be a move beyond a public health crisis. So right now, the economic crisis is bigger than the public health crisis as we speak. So and that there needs to be. I mean, clearly the government is not being able to provide to the needy as much as it should, but so the need for social sector and private sector needs to be coming together. and then prepare for in the coming days. How do we gradually increase testing very rapidly, understand where we are in the economic in the infection curve, and then eventually gradually start to open up the economy in a very after mitigating the risk as much as possible. So I'll kind of stop here and hear from others. Thank you very much. Let me close the screen.